This year is the 8th year since the province declared the toxic drug crisis a public health emergency. Drug poisonings related to the toxic, unregulated drug supply continues to take the lives of First Nations people in BC at 5 times the rate of non-First Nations people in the province. Sorrow reverberates throughout our communities as the pain felt from every person lost to toxic drugs lives on in the family members and friends left behind. This grief is experienced by many of us at the FNHA. We stand with and send our deepest condolences to all of those who have lost someone. Into the 8th year, many frontline healthcare workers who support the individuals, families, and communities impacted are experiencing distress and burnout. In intensifying our efforts to end this crisis, FNHA moved to a Level 2 emergency response to provide more support across the spectrum of health and wellness services. We continue to use Indigenous harm reduction approaches grounded in culture and cultural safety to save lives. We have also made an effort to focus and lift up stories as part of our response to help address ongoing stigma and misinformation that surrounds substance use and decriminalization. The FNHA has created a special memorial site where grieving people can honor loved ones lost to drug poisoning using a story, video, photo, artwork, or an audio recording. We have collaborated with Moms Stop the Harm to create new resources that feature Indigenous ways of healing and managing grief and loss of a loved one to drug poisoning. We know that the disproportionate number of toxic drug deaths we are experiencing in our communities is in large part a consequence of racism and colonialism. The First Nations Health Authority remains committed to anti-racism work, including continuing to take strong, innovative actions to transform the healthcare system and to develop and implement culturally safe programs, resources, educational materials, services, and supports.